Welcome back to Voices of Dental AI. I'm your host, Loren King, and today we're diving into a topic that sits at the intersection of ethics, precision, and protection in dentistry, which is malpractice. Joining me today is Dr. Stephen Feit, a leader in biomechanical reconstructive prosthetic dentistry. He's a researcher, he's an author, he's a patent holder, and expert witness who's spent decades helping both clinicians and patients navigate the complexities of treatment outcomes and clinical accountability. Dr. Feit, thank you so much for being here. I'm so happy to have you.
Thank you for having me, Lauren. It'll be a very interesting discussion, I hope.
Yes, it will. Absolutely. So you served as an expert witness and an advisor for the Agency and Health Administration in Florida, correct?
Yes.
So from your perspective, what are the most common causes of malpractice cases in dentistry today? And then what do you think is most misunderstood about them?
Okay, so just to clarify what that agency is, really the Board of Dentistry. So I was actually charged with determining if there was probable cause from a patient's complaint. Based on the patient's complaint and the records of the treating provider, I would then determine if there was validity in the claim of the patient. If there was validity, it would be probable cause and it would be moved on to the Board of Dentistry. Then I would determine that there was no probable cause and the case would die right then and there. So it's quite powerful. Now, here's the catch. I did it for 6 years and not 1 second of my time was spent learning what the parameters are for probable cause by the Board of Dentistry. So can you imagine that a patient generates a complaint to a so-called expert who has no training whatsoever in understanding what probable cause is, let alone they can't even define it. So what most experts I have found, because I have done 60 board defenses or more, I'm 60 for 60 in board defenses where I help the attorney represent the dentist in the crosshairs. And the dentist gets off with no sanctions, no CE, no fine, no penalty. And the reason is because I know the inner workings of the Board of Dentistry. And I know that the expert, so-called expert for the Board of Dentistry has no training whatsoever. So their assumption is just because the complaint was generated, it has validity. And it doesn't. It does not.
I feel like as a clinician, it's a fear, right? If anybody makes any type of complaint against you, to my knowledge, it has to be looked into, right?
Yes.
And
Sorry.
oh no, well, I was just going to say, and it, whether the validity of it is high or not, right? So that's kind of terrifying when you think about it as a clinician. It's like no matter what you do, you can do all the right things, you can say all the right things, you can document like you're going to federal court, but at the end of the day, anyone can make any type of claim at any time.
Yes. And typically the claims are triggered by a subsequent treating dentist. So that dentist looks and says something disparaging about what the previous dentist performed. And then it's an idea in the head. Usually the patient will seek out a malpractice attorney and they'll take the case on contingency. So there's no charge, of course, to the patient. But if I'm doing defense work and I'm in deposition and the plaintiff attorney who is on contingency is deposing me, it is very, very contentious. It is very antagonistic and it can get very personal because I'm the one standing in the way of them securing funds for their client, of which they get 35 or 40%, whatever the split is.
See, I didn't realize that.
Yes.
Okay, got it. So would you say that you're seeing more malpractice claims related to like communication gaps and documentation rather than clinical errors themselves?
I see both, but to your point, that's a great question. Typically speaking, the communication gaps are what lead to the suspicion of malpractice. Why do I say that? Culture in the office is critical to mitigating malpractice. Why? Culture is determined long before the patient even comes in the door. So now we're going to weave in almost like practice management. What happens when the patient walks in the door? What happens when they call on the phone? How does the office look? How does it smell? How are they handled? How long is the wait time? How are they nurtured? How is the injection? How is all those things that come into play in the experience? If the patient feels that they've been slighted and unheard, then a lot of them are seeking a pound of flesh. And even if there's nothing done wrong, there's nothing from stopping them from initiating a suit. So we have to define a couple things. If the office receives a letter requesting records, that is not a suit. That is just discovery. They're just looking at the records to determine if there is an action that is valid, because the attorney is not going to walk down the road unless they know there's recovery, because they're on contingency, right? They don't get paid until they either settles or is a verdict in court. Once it's filed suit, once an expert witness generates an affidavit, so the attorney would ask me, can I look at this case? Is there probable cause? Is there a validity in pursuing this matter? Or are we going to be embarrassed in court if it gets there? So my job is to kind of advise and counsel the attorney if there is any validity. If there is validity, then I would be asked to sign an affidavit. So the affidavit then is returned to the attorney. The attorney with that affidavit then files suit in court unless there's a settlement. Now you can file suit and then settle. It can be settled at the steps, right? It can be settled as you're sitting down in the seats in court before the judge. It can settle anytime. But that's not my decision. It's, so if you look at it, the attorney is the weapon and the expert witness is the ammunition. So how powerful, how good, how strong is my take on things and the way I present myself and how articulate and all that stuff. So to your point, do I see more cases? Well, it's hard to know if the landscape is producing more cases or actually my reputation is so far now ahead of me. I've been doing this for 35 years and hundreds of cases that attorneys know what type of cases when they're and they'll hire me. They'll seek me out because I have a backbone where most people have a wishbone. I'm confrontationally tolerant. My ethics are not for sale. They're non-negotiable. So I can share with you, it's very fascinating. The first question, in case anyone's looking to become an expert witness, there is the first time you're sworn in. And, it's a nerve-wracking kind of thing because you just don't know what they're going to do. And the opposing counsel is going to be super nice. And they ask you some general questions like a lie detector, what's your name and where do you practice? And very easy questions. And then they say, how much are you being paid or compensated for your testimony today, doctor? And that's a rabbit hole. So I don't get paid for my testimony. My testimony is mine and mine alone. I say whatever I want to say, and I speak to the truth. I get compensated for my time, my experience, my years of practice, my educational background, etc. So that's a huge trap. And nearly every first-time expert will jump in. They'll say, I make X dollars an hour. Oh, so if I paid you Y dollars, which is more than X dollars, then would you say what I want you to say?
Ooh, that's a slippery slope.
So now you have credibility issue, right? Then the next question is, have I ever been sued? And the answer is no, I've never been sued in or out of the dental arena, thank God. And I've never been even close because we relationship build. As we alluded to earlier, we controlled, in my practice, we control how the experience is prior to coming to the office, even prior to the phone call, because we created a referral machine. And so a referral machine, people are like, I've never heard that. Well, you have to be careful the words you choose. They become your thoughts become your actions become your habits. So what do you really want to create? I don't want to market on TV. I don't want to market on Google clicks. I want people that we know that we are friends with that are non-litigious. So we're strict gatekeepers. And how do you do that? Well, there's ways to encourage referrals and so forth. And most of my patients are very much older by definition changes as I get older. So they're in their sixth, seventh, eighth decade of life, ninth decade of life, right? And many of them are very young at heart. They're playing tennis and everything, but they don't do Google reviews. So I don't have 5 million Google reviews. I did have a lot of patients because they share their experience.
I feel like there's always something that most dentists like they just don't talk about it, right? It's like there's an emotional toll of a malpractice claim, right? There's your credibility, your integrity, your reputation, or if you're a practice owner, you're at risk with your staff and the credibility with them. But even if they've done everything right, it could still damage their confidence, their reputation, like I said. So what's your advice to practitioners who are navigating that fear? So how can they like proactively protect themselves?
That's a powerful question because the psychology, I'm not allowed to know the dentist if I'm doing defense. I'm not allowed to know the patient if I'm doing plaintiff. So I can't know any of those parties. I'm not allowed to speak to the dentist until after the case is adjudicated. Either it's settled or it goes to court or whatever. And I always am curious because life is a classroom, right? We're always learning, growing, and that kind of thing. I would say to them, why do you think this case came about? What would you do differently? So they're like, well, I should have been nicer. I should have called for post-op. I should, whatever it is, or I should have never treated them. They were red flags and I, don't- I needed the money. Once the case is started, I don't know the psychology except from what the attorneys tell me how yeah, they're having sleepless nights, they're anxiety ridden. Can you turn around the paperwork as quick as possible? Like do my chart review. And I do because I'm very empathetic because I prefer to do defense work, but plaintiff work is so much easier. So after the case, the dentist will ask me, what courses should I take? What should I do? And that kind of thing. So I said, so a lot of times they'll say, "How would you like me to refer to you?" And they'll say, Dr. Jones. And I say, that's interesting because I've never been sued and none of my patients call me doctor. They all call me Steve or Steven. When a patient asks me, would I mind if they refer to me as Steve or Steven? I'm in. I know now. Now I'm in the inner circle. They're gonna be my friend if something goes amiss. The lab doesn't deliver the crown or whatever it is on time, or something happens clinically. You know, we all have our bad moments, right? We want to minimize them, but we want to apologize, make restitution instantly, and repair it. Well, if the patient is reasonable and I'm reasonable, we'll have a reasonable relationship, right? And if you do, then they're going to give you every opportunity to make things right. They want you to make things right. They'll allow you, right? There's latitude. And I've had hundreds of phone calls where the patient, as a prosthodontist, they'll seek me out when the dentist messed up, or in their mind, their perception is that it was messed up. So sometimes it's not. It's perfect. They just need validation. But I have never triggered a case where I've actually put out all the fires. And I'll say to the patient, let me call the dentist, see how we could sort it out. And I'll say to the dentist, look, you could redo it, but while you're redoing it, guess what? You could be seeing 2 or 3 other cases that are probably easier, nicer people. You're not going to feel like your back is against the wall because if you don't do it right the next time, you know it's going, right? So what kind of pressure is that? And then it casts a pall on your culture all day. I never looked to see who was on the schedule the next day, but if you see that patient on the schedule a week from today, for the next week, you're stressing over it. So I say, well, why don't you just write a check, have them sign a release and tell them, listen, I see the future and you're not in it. Just make life easy. It's simple, but they don't want to return the money. And I say, consider it marketing, if you wanted to look at it as a justifiable expense. And then I'll say, just don't give me an answer because the usual answer is, I'm not giving back the money. I worked too hard. No way. I can't get my time back, or I have lab bills I incurred. And I'm like, listen,
You think that's ego?
Well, it's ego a little bit, but it's mostly financial. They're thinking, look, I had overhead against this. I had chair time. I really did my best. No dentist that I know yet has ever woken up in the morning to say, who can I damage today? So to be clear, and to answer your question very more direct, the difference between malpractice and assault and battery, and in some states, assault and battery is running up to someone within their safe zone, which is usually arm's length, and going nose to nose with someone. That's considered assault and battery. You don't even have to touch them. But malpractice transcends assault and battery because there's no intent. Hopefully, there's no intent, right? But the dentist will report to me, I feel like the patient feels that I punched them in the face, that I hurt them really bad. Like, that it's personal. It's all personal. They're not returning, some broken item that they bought at Target. They're saying that you're horrible, you hurt me, I'm suffering, it transcends the dollars that I paid you. I want more than what I paid you because of pain and suffering. And guess what? That attorney's got to get paid 40%, right? So there you go. And then if the claim is settled for more than a certain amount, it has to go to the board. The board of dentistry is alerted. That's why I suggest giving back the money, because when you sign the confidentiality agreement and the release, the patient signs the release, there's a built-in confidentiality agreement that the patient can never disparage the dentist. Otherwise, then it's libel and slander, depending on how they do the disparaging. And then there's really damages that can be secured. And you make that clear to the patient. Listen, you don't sit around the dinner table at the country club with 8 other couples and talk about me. That's off limits. I'm buying my peace and quiet. That's
Right.
that's really what it is.
Absolutely. Wow. Okay. So with the innovation piece of it, or segueing into the innovation piece of it, I know that you've been at the forefront of that. So I want to talk about how you think AI is shifting malpractice prevention, of course, but not just through like automation, not just, through anything like that, but through accountability. So how do you see tools like what we're doing at Trust AI, like Isaac, helping reduce that risk for clinicians?
Well, it's a game changer and it's massive. I'll tell you the flip side, the 180. I just received two or three, actually three new malpractice cases. And there were some questions I had about some technicalities of the procedures that they did and some nuances. And I called Isaac, who's the AI, the trust AI that you're referring to. And I said, Isaac, hi, this is my question. Now, what's interesting is it has been reported that the nicer you are to Isaac in AI, the better the responses Isaac provides. Now, what a commentary, that common courtesy dictates an amazing result, better result, right? So I call Isaac. Hi, Isaac. It's Dr. Stephen Feit. It's been a little while. How are you today? And then he responds. And then I say, Isaac, I need a huge favor from you. This is the following question. And then I ask the question. I have a whole relationship with Isaac, but I want the best result. But it's in my DNA. I mean, we have a courtesy system that we run our practice with. We use the courtesy system in my personal life with our 4 kids. Our kids are in their 20s now, but people remark, boy, your kids really are very close. I go, yeah, well, that's not by accident. I mean, that's an expectation, but like my office team is very close. We're a little family. Our patients are very close with us. It's happiness centered is what we call it. And you got to pick your words. We don't have dental assistants. We have care nurses. Now, they're not a nurse like an RN, but they're caring for the patient while they're nursing the patient, and it elevates their status. And the better and happier my people are, the better and happier I'm surrounded by those people. And they go home happy, their spouse. I mean, they would say to me, oh, I wish I could work in your office. One of my ladies said, her husband said. And I didn't understand it first,
Yeah.
but it's powerful. And so you want to mitigate malpractice? Don't be a doctor, be a human being, be heartfelt.
So Speaking on the innovation side of it and the AI side of it, do you think that AI could eventually become, let's say, like the standard of care for verifying decisions and treatment recommendations in the future as it relates to malpractice?
It's an amazing question. Why? Because first we have to define standard of care. That's usually a question in deposition. What is the standard of care? So there's no exact one definition that's standard and usual and customary in any nomenclature anywhere that says what the standard of care is. So the basic feeling of this when I'm asked is what a typical dentist, a similar dentist in a similar town or city that dentist was in would do on a similar patient with similar problems, right?
Mm,
So that's kind of the standard. It's a very vague or loose term definition.
mhm.
So what I would recommend is that everybody adopts a higher standard than usual and customary. My saying is the usual and customary stinks, right? Who wants to be usual and customary? So yeah, to your point, you want to set your own standards. If you have this tool and the tool will keep you out of malpractice and malpractice, I'm not talking in the legal arena. I'm saying bad practice with your patient. What if your loving spouse in the chair? What if it's your child who you love is in the chair? Do you not want to avail yourself of all the information of every possible consequence that could arise that you may have a question about and have that as the benefit? But to your point, now you have documentation that substantiates your behavior, and that's the whole purpose of the dental record, is to substantiate your behavior and what you did and why you did it so that Einstein said a short pencil is better than a long memory, right? But if you didn't write it down, didn't happen. That's what the attorneys will tell you, right? So yes, I agree with you. It is my personal opinion is that it is the standard of care because it's available. It's readily available now. So if you're not using it, and I'll give you an example of a case I just got. Patient's numb in the mandibular nerve. They were given like 8 carpules of articaine. Articaine is implicated in nerve damage. Not only did they give it, they gave a lot of it, and the patient subsequently developed this nerve pattern. So is there a probable cause? Yeah. Well, what if you said, "Hey, Isaac, got to give a mandibular block. What's the drug of choice?" And in 2 seconds or less than 2 seconds, a nanosecond maybe, it'll say carbocaine, lidocaine. End of story, right? Why not?
Keep away from setting yourself up like that.
That's powerful, right?
Yeah, absolutely. I've heard you say before, and correct me if I'm misquoting you, but you said a mistake becomes malpractice only when it isn't learned from.
Yes, you said a mistake is only malpractice when it isn't learned from.
Yeah,
Well, I think you can go, a perfect person never knowingly makes a mistake, right?
right.
So if you make a mistake and you are below the standard of care, it happens to all of us. I don't care who you are.
Like,
You just recognize it and you say to the patient, listen, I don't like the way that worked out. I know that you're not, 100% with this. I want in my heart, I woke up at 3 in the morning and I was thinking of you,
yeah.
heartfelt. I'd like to redo it with your permission, right? Permission statement and apology and restitution instantly. And you get more referrals from that scenario, oddly enough, than when everything goes right on because everyone expects everything to go straight.
So how do you think AI can play a role in creating like a safer, smarter feedback loop where you're helping dentists from like data instead of just repeating the same patterns, right? We walk in the office, we go straight into that autopilot mindset. This is what I was taught, this is what I'm supposed to do. And if I do those two things, then these are the outcomes, right? But that is very black and white, and we live in a world of total gray. So what do you think there?
Yes, I think AI is a built-in second opinion, and there's like it's instantaneous. I remember when I was in my residency at Boston University for my prosthodontic training, we had to do research presentations so that we got used to speaking in front of people and presenting thoughts and ideas and that kind of thing. And we had to go to the library and pull the Index Medicus, and we had to go to each shelf and pull the book and yeah, update myself, Xerox, make a copy of the article and all this kind of stuff. And my brother followed me several years later, And what would take me maybe 30 hours to do a presentation and preparation work for a 1 hour presentation, it would take him maybe an hour. And now with computers, maybe it's half an hour. And with AI, maybe it's 3 minutes. It's just that powerful. So there is no excuse not to use it. You can't tell me you don't have the time. It's instant. It's amazing. It's phenomenal.
All right. So if you were to fast forward 10 years, what does an ethically sound AI supported dental practice look like to you?
My thinking is that the AI will be able to schedule, move patients, do everything, optimize, help with treatment planning, verify treatment protocols, do reminders for the doctor, for the team. Probably it's going to order supplies, scour the internet, find the best pricing, and just do the ordering, automated, and that kind of thing. I think it's going to be revolutionary. And it's still going to be Amazon proof, right?
Right. What's your message to the next generation of dentists who want to embrace technology, but they still want to honor the human side of care, right?
Right. Yes. So the first day that I was in my residency at Boston University, the cafeteria was quite small and it was packed, crowded. There wasn't a seat to be had. It was my very first day. I didn't know a single person there. I come out of the cafeteria line. I have a little tray of food, and a hand goes up and motions me to come over. So it's a four-top table, and it's right opposite the door that goes to the hallway down into the cafeteria. As I sit down, I meet one of my professors. I knew the name, but I had never seen him before. So we shook hands, and he said, "Here, join us." I sit down and I look up, and Henry Goldman is sitting across the table from me. So the school is called the Henry M. Goldman School of Graduate Dentistry. And I look up and I said, Dr. Goldman, what an honor. Didn't see you. I was just trying to sit down without dropping my plate of food. So he says, "Please call me Henry." So I said, I'm all nervous and everything. And I said, "Okay, Dr. Goldman, sure." And he points his finger at me and he says, No, I told you to call me Henry. And I don't like pointing at somebody because there's always three fingers pointing back at you, which I had never heard before at that time. And he said, "I'm pointing so that you would, it would be with emphasis that I ask you to call me Henry." So I said, "Certainly, Henry." So with that, you hear the garbage can being rolled down the hallway, and it's a little old janitor. He's bow-legged, and he's got the garbage can. And Henry yells, "Hey, Charlie, come on, put that thing in the closet and take a load off with me." So one of the other fellas got up and left. So there was an empty chair next to Henry, diagonally across the table from me. Charlie goes to put the garbage can in the closet. With that, Henry gets up, and I'm watching Dr. Goldman, and he goes to the cafeteria, gets a can of soda, grape soda, and he waits on the end of the line to pay for the soda. So he didn't cut the line, he didn't take it for free. But it wasn't Coke or Pepsi or Sprite or ginger ale, it was grape soda. So it told me that this isn't the first time that these two guys sat down and broke bread together, right? He called him Charlie. So Charlie comes in about the time Henry sits down with the soda, and Charlie says, "Hey, Henry, how you been?" Right? "Hey, Henry, how
Henry.
have you been?" Right? So Henry says, "Hey, Charlie, I want you to meet Dr. Feit." I said, No, Henry, it's Steve." And he says, "Okay, Dr. Feit." So he's teasing me. So I point a finger at him, but I put my hand in front of the finger. So I'm sitting there with Henry and Charlie and my professor. So later on in the day, my professor saw me in the clinic in the afternoon. He said, "Hey, wanted to ask you, what'd you think of lunch?" I said, "Listen, if you kick me out right now, I've learned a lesson no one else will ever get." And he said, "What's that?" I said, "You judge how big a big man is or big person is by the way they treat their fellow people." I said, "And now I'm really good friends with the most powerful person in the school." And he said, "Oh, Henry, you and Henry are good?" I go, No, it's not Henry, it's Charlie. Charlie's got the key to every door in the building. Interesting, right?
I love that. But it's so true. Story. That's incredible.
You have to pay attention to the I guess the universe is bringing you all this kind of stuff. I'll tell you one other story. Jerry Spence wrote a book, How to Argue and Win Every Time. He was a famous attorney. I must have read the book 35 years ago. So Jerry Spence, the true story, he was a young attorney, about 25 years old, right out of law school, and he was defending this gentleman who is accused of murder. And he's about to make his closing remarks when he stood up, and his closing statement were on index cards, and all the index cards fell on the floor because when you get nervous, your fingers get sticky and you lose your fine motor skills, right? So he proceeds to bend down, pick up all the cards. They're not numbered, so he doesn't know what order they're in. And as he's doing so, he hears the jury laughing and the judge is laughing. And he looks up out of the corner of his eye with his client next to him who's up for murder. And he shook his head and he stood up and he left the cards on the floor and he turned to the jury and he says, I think you would agree this gentleman deserves better counsel, better defense, a more experienced attorney, someone who can actually defend him properly. And with that, the closing argument just flowed right out of his body, he said. Why? He said he learned from that moment on to be heartfelt, to be loving, to be kind, to be truthful, to be with ethics and integrity. And when you speak like that, everything becomes real. So you want to mitigate malpractice, be Jerry Spence and speak from the heart. Be a human being, be a person, be Henry, be Charlie, and let the people decide what your title is from there. Prove yourself.
Absolutely. And I think there's nothing wrong with saying, I don't know, or I could have done that better, or I remember you and I were talking off camera when we first met, and I was talking about making mistakes and things like that, and how it made me who I am today, right? I can't go backwards, and I'm proud of who I am now, so I have to honor anything from the past. And you corrected me. You're like, Loren, those are lessons. Those are not mistakes.
That's right.
That stuck with me. So that was like maybe a month ago. And ever since, I've tried so hard. Anytime I say the word mistake, I'm like, no, 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 lessons. But the more we evolve as humans, I hope we keep the humanity part of us. Of this is everyone's first time that we know of doing this in this human experience, which means none of us got a guidebook, not a good one, at least. Like we're ever evolving, we're ever making, lessons and things like that. But when it comes down to it, if someone does something and they're a good person, this is how I feel. There's probably a reason, right? You saw the decision that they made, but you didn't see the choices that they had, right?
Yeah.
And keeping that mindset of, yes, they may have made the biggest mistake of their life, or they may have made the biggest lesson of their life, but what other choices did they have? Were they completely backed into a corner? Were they under high pressure? Was the patient very, very critical or combative? I've had combative patients, right? Where I would walk in the room and it was just, it didn't matter what I was about to do or say. I was already the enemy. And I think if we continue to come from that mindset and we give human beings the benefit of the doubt and we try to get to the same level as a species, the profession and humanity in general will be better for it.
Absolutely. And AI is weaved into this relationship and it becomes an integral partner in everything that we do, whether it be in dentistry or out of dentistry. This is the future. And
Mhm.
I'm sure most everyone's used some form of AI, whether they know it or not, and they actively now seek it. Instead of doing Google search, they'll do a chat GBT or whatever the AI of choice. And does it, I mean, it's just remarkable what it can actually achieve. And if it can keep you out of trouble, and to your point with the nasty patients, everyone listening has had that. And it's really, really devastating because we're nurturers that otherwise we wouldn't be doing it for, or at least doing it long. And we're caregivers. We care a lot. It's to the core. And then when someone is really rude, but I came to realize over time, some people do get rude when they're in a very stressful situation that they feel out of control. So they're in the dental chair, they have to keep their hands on their armrests, And we're now in their personal space, in a very, very intimate personal space. And they're out of control. They have to sit there and take it for, an hour or longer. And it's invasive, can be invasive, and they're out of control. So that's why the malpractice is always looming, because that's the one thing that they can control. They say, you want to tie my hands behind my back? Well, here we go. And so, you make a post-op call. If you time it, the post-op call is 8 seconds. Hi, I was just thinking of you. How you feeling? Oh my God, I can't believe you called. They're in the middle of doing something else anyway. They want to get off the phone. Everything good? Yeah, everything's good. Okay, have a good day. Hey, tell all your friends to come in.
Yeah, it makes it, especially if it comes from you and not an assistant or
Oh,
front desk. It's like, no, oh, the doctor's calling me or the hygienist is calling me. It's like, yeah, they care, right?
right.
Dr. Feit, I just want to thank you so much for joining us and sharing your expertise. It's been very, very educational, as I knew it would be, but your insight into how accountability and documentation and AI all come together to protect both patients and clinicians, so both parties involved, is something every dental professional needs to hear. Until next time, this is Voices of Dental AI. Thank you, Dr. Feit.
Thank you. Have a nice day.
You too.